Hello students, let's study about blood cells, that is RBCs, WBCs and platelets. RBC, also called as erythrocytes, that is red blood cells. They are anucleated biconcave cells, and normally in male they are 4.5 to 6 million cells, and in female 4 to 4.5 million cells per cubic millimeter. If the RBC count is increased than the normal range, it is called as erythrocytosis. It is seen in hemoconcentration due to diarrhea or vomiting, burns, cholera, high fever, exercise. In cyanotic states like chronic heart disease, in polycythemia also we can see erythrocytosis. If the normal range of the RBC count is low, it is called as erythrocytopenia. It is seen normally in old age, pregnancy, anemia, pancytopenia. Reticulocyte, it is an immature RBC which is developed from the late normoblast, and then it continues to develop into the RBCs. So the cell size is around 7.5 to 8 micron, nucleus absent, but cytoplasm contains hemoglobin in large quantity with little RNA, ribonucleic acid. Normal range of reticulocyte in adults is 0.2 to 2%, in infants it is 2 to 6%. Reticulocyte count is increase is called as reticulocytosis. It is seen in hemolytic anemia, acute blood loss, hemolytic disease of newborn, thalassemia, iron deficiency anemia. And absence or low count of reticulocytes is seen in bone marrow suppression, that is aplastic anemia. The next parameter from the CBC is leukocytes, also called as white blood cells or corpuscles, and they are nucleated corpuscles, and based on the morphology they are divided into granulocytes, which consist of neutrophil, eosinophil, basophil, and agranulocytes, that is granules absent in the cytoplasm, and they are of two types, lymphocytes and monocytes. The normal range in adult, it is 4,000 to 10,000 cells per cubic millimeter, and in newborn baby it may be 10,000 to 25,000 cells per cubic millimeter. If the WBC count is increased, it is called as leukocytosis, and it is seen in infections like bacteria, virus, protozoa or fungal infection. If the WBC count is less than the 4,000 cells per cubic millimeter, it is called as leukopenia. It is seen in typhoid fever, tuberculosis, influenza, AIDS, dengue, falciparum malaria. So chronic conditions you can see leukopenia, and acute condition you can see leukocytosis. So fifth parameter from the CBC is differential leukocyte count. So in that, granulocytes, that is the granules seen in the cytoplasm, so they are of three types: neutrophil, eosinophil and basophil. So neutrophils are usually for 10 to 14 micron in size, and the cytoplasm contains fine pink color granules, and nucleus has the 2 to 3 lobes. Eosinophil, it is usually bilobed, and the cytoplasm contains orange coarse, that is bigger granules. Basophil, the nucleus is either bi or trilobed, but the cytoplasm contains plenty of the bluish black color granules. Then agranulocyte, so first is lymphocyte, so it is round nucleus with round cell with slight bluish cytoplasm without granules. And monocyte, the nucleus is kidney shaped, and it is biggest cell, that is 14 to 22 micron in size, and the cytoplasm is grayish blue color without granules. Now we can see pathological leukocytosis because of the neutrophilia, that is increase in neutrophil count, and it is seen mainly in infective condition, that is infection due to bacteria, virus or parasites. Then inflammatory condition like rheumatoid arthritis, acute rheumatic fever, myocardial infarction, or because of the operation, fracture, and can be seen in if the count is raised more than 70 to 80,000 or 1 lakh, it is called as leukemia. Then lymphocytosis, it is increased lymphocyte count. It is mainly seen in viral infection like mumps, measles, influenza, rubella, and some bacterial infection like typhoid, tuberculosis, syphilis. Eosinophilia, it is increased eosinophil count, and it is due to allergy to dust, drugs, or asthma, hay fever or parasitic infection. Monocytosis, it is increased monocyte count. It is usually seen in viral infection like infectious mononucleosis, then malaria, typhoid, kala azar. Basophilia, it is increased basophil count. It is seen in chronic myeloid leukemia. When the WBC count is less than 4000 cells per cubic millimeter, it may be due to neutropenia, that is decreased neutrophil count, and it is seen in bacterial infection like typhoid, viral infection like measles, influenza, in anemia like aplastic anemia, megaloblastic iron deficiency anemia, or bone marrow depression because of the chemotherapy, radiotherapy. Then lymphocytopenia because of the viral infection or typhoid or excess radiotherapy or leukemia, AIDS, anemia, pancytopenia. You can see lymphopenia. Absolute eosinophil count. So they are eosinophils total in count present in blood per microliter. So normally they are 40 to 450 per cubic millimeter. Clinically, if they are increased, they are seen in parasitic infection, allergic reaction, and some leukemias. And decreased eosinophil count is seen in increased adrenal function. The next parameter is total platelet count. They are 2 to 3 micron size platelets seen in blood, and normally they are 2.5 to 5 lakh cells per cubic millimeter. In clinically, the platelet count is important for the investigation of bleeding disorders, and if the platelet count is decreased, it is called as thrombocytopenia, and it is associated with the prolonged bleeding. It is seen in aplastic anemia, megaloblastic anemia, acute leukemia, dengue fever, falciparum malaria. If they increase platelet count, it is called as thrombocytosis, and it is seen mainly in splenectomy patient, that is removal of the spleen, and in chronic myelogenous leukemia. So peripheral blood smear, first is the sample collection. So it is a simple and gold standard confirmatory test for the malaria and filaria or other blood parasites. So specimen, the collected peripheral blood from the earlobe or by finger prick or great toe in the infants. The time of taking blood should be collected few hours after the height of the paroxysm of this fever and before taking antimalarial or antifilarial drugs. Frequency, smears should be examined at least twice daily until parasites are detected. The types of the blood smears, there are two types, thin blood smear and thick blood smear. So you can see in this picture. So the observation in thick and thin smear. So usually in thick blood film, you can see only the imprints of the parasites, that is the ring form blue in color and the nucleus is pink in color, and very few RBCs you can see. And thin blood smear, you can see plenty of RBCs containing the ring form of the parasites, that is thin nucleus is pink in color and the ring is blue in color. Now we will see difference between thick and thin smear. So usually thick smear is used for the screening purpose and thin smear is used for the identification of the species by different morphological forms. So thick smear, the advantages, it is more sensitive. When only 5 to 10 parasites per microliter of blood is there, you can see the parasites. And the quantification of the parasite, that is parasitic index, you can make out from the thick smear. And demonstrating malarial pigments like Schaffner's dots, Zeeman pigments in the different species of the malaria. The disadvantage of the thick smear, the species identification is not possible. The thin smear advantages, the species identification of the malaria is possible because of the different morphological forms, that is ring form, tropozoite, seizoid, gametocyte form of the species. The disadvantages, it has the low sensitivity, so you need more than 200 parasites per microliter of the blood to see the parasites. So these are different morphological forms of the parasites of the Plasmodium vivax. So first A shows ring form of the Plasmodium vivax. The ring is thick blue in color and the nucleus is pink in color. Then you can see the RBCs containing Schaffner's dots, that is pink color dots, and the amoeboid tropozoite of the P vivax, that is blue in color and the nucleus pink in color. Then you can see schizoid form in the C, that is many merozoites are there in the regular round structure, that is schizoid form. Then you can see male gametocyte and female gametocyte form of the Plasmodium vivax. Now you can see in A, that is Plasmodium falciparum morphological form. So in A you can see ring forms. So there are few RBCs containing multiple rings, few RBCs containing the headphone appearance of the ring form of the Plasmodium falciparum, or you can see a cold form. Then in B you can see banana shaped B and C you can see banana shaped gametocytes of the Plasmodium falciparum. So only two stage forms are seen in Plasmodium falciparum. Seizont and tropozoite are usually not seen in peripheral blood. Then in D you can see ring form of the Plasmodium ovale. So RBC is oval in shape, so you can, because of that the name is Plasmodium ovale. And in E you can see band form tropozoite of the Plasmodium malari. So uses of the peripheral blood smear for the blood parasites. So first is Plasmodium species, then Trypanosoma, then Leishmania. You can see LD bodies, then Wucheria bancrofti. So microfilarial forms you can see in the slide. So these are different parasites you can detect into the PBS. Uses of peripheral blood smear. So reporting can be done. First is RBC morphology. So we can see size, shape and inclusions present in the RBCs. So here few examples. So in size variation can be bigger RBCs, macrocytes, smaller RBC, microcytes, oval macrocytes, or according to the color of the RBCs, it is hypochromasia if it is pale in color. If it is purple in color, then it is polychromasia, or hyperchromasia if they are spirocytes. Then different shapes, it can be target cell, teardrop cell, oval cells, elliptocytes, tomatocytes, pencil shape, sickle shape, burr cell. So these are different shapes. And inclusions, some basophilic stippling can be present, purple granules inside the RBCs, ring form that is called cabot ring, hinge bodies. So the Hoyle-Jolly body seen in megaloblastic anemia. So these are different RBC morphology we can see. Then WBC we can report as total count, whether it is normal, increase or decrease. Differential count, whether it is lymphocytosis, neutrophilia or eosinocytophilia. Then abnormal cells, any atypical cells, blast cells or other abnormal cells. Platelet count can be normal or abnormal. And then morphology, so normal in size or bigger in size. Then parasites like Plasmodium, Filaria, Leishmania, different morphological forms, ring form, tropozoite form, gametocyte form, seizont form, or in Filaria, microfilaria we can see. So this is reporting of a PBS. So to summarize the uses of CBC, that is complete blood cell count. So hemoglobin helps to know the anemia and which type of anemia can be sickle cell anemia, thalassemia, megaloblastic anemia, iron deficiency anemia. Then total RBC count helps in knowing the anemia, polycythemia, and then RBC different morphologies. Then total leukocyte count and differential leukocyte count helps to know the infection, inflammation, leukemoid reaction, multiple myeloma or leukemia. Platelet count helps in bleeding disorders like dengue or falciparum malaria. Then RBC indices helps for the morphological classification of anemia, whether microcytic or macrocytic. If microcytic, it can be seen in iron deficiency anemia, sickle cell anemia, thalassemia. Macrocytic can be seen in megaloblastic anemia, hemolytic anemia. Then RDW, that is red cell diameter width, is important parameter, can be calculated only by the automated cell machine. And if it is increased, it is seen in anisocytosis, that is thalassemia, in that it is normal. So these are the uses of the complete blood cell count. Hope you find this session useful for your understanding and for your exams. Thank you.